I welcome you guys to THIP Media's live session. We are back with yet another live session on diabetes, and I am very happy to be here. So today the live will be on how do we manage a diabetic foot. And for the same, for the discussion for the same, we have Dr. Ashirwad Pawar with us. And today we will be talking about how to manage diabetic foot. And let's just invite Dr. Ashirwad, and then we can just Pawar is an MBBS and an experienced diabetologist. He has expertise in evidence-based diabetes management from Dr. V. Mohan Diabetes Specialities Center and PHFI. So Dr. Ashirwad Pawar holds a certificate program for clinicians in diabetes management from RSSDI, and he is currently working and serves as a consultant diabetologist at Sai Aashirwad Hospital in Mumbai. How are you doing, sir, today?
Good. How are you?
All good, all good. We are really happy to have you here, sir.
Thank you for having me.
Okay, perfect. Let's just dive into the session. And okay, so the first question for the session would be, how does diabetes change the structure and function of the feet, and what specific challenges does this pose for patients in terms of mobility and sensation?
Okay. So before answering your question, I would like the viewers to know what diabetic foot actually means. So let's break it
Yeah.
down. So one of the things that can happen because of diabetes is that it messes with the nerves and the blood flow in your feet. The combination of nerve damage and circulation issues is what we call as diabetic foot. Now, why does this
Okay.
matter? Because when the nerves in your feet are damaged, you might not feel the pain or discomfort like you normally would. Imagine if you had a small pebble in your shoe, but your foot couldn't tell your brain that it's bothering you. You might keep walking and the pebble could just rub against your skin and cause a sore or a blister without you even realizing it. So meanwhile, the
Yeah.
circulation problems mean that your feet might not get enough blood flow to heal properly. So even if you get a sore or a cut, it might take much longer to heal than someone without diabetes. This can lead to very serious complications like infections or even the need of amputation if things get really bad. So
Okay.
basically, diabetic foot is all about your feet having a tough time because of diabetes. It's super important to take care of your feet, check them regularly for any cuts or sores, and wear proper shoes to protect them. And of course, keeping your blood sugar levels in check is the key to preventing diabetic foot problems in the first place. So getting back to your question, so diabetes can have a significant effects on the structure and function of the feet, leading to a condition known as diabetic foot. So there are several ways in which diabetes can impact the feet. First is neuropathy. Diabetes can cause peripheral neuropathy, which is damage to the nerves in the extremities, including the feet. So neuropathy can result in decreased sensation, tingling, burning, or pain in the feet. This loss of sensation can make it difficult for patients to detect injuries or ulcers in the feet, leading to delayed treatment and increase the chance of infection. Second would be the peripheral vascular disease. Diabetes can also affect your blood flow to the feet, leading to a poor circulation. Reduced blood flow can impair the healing process, making it harder for wounds or ulcers to heal. It also increases the risk of developing infections or other complications. It can also cause change in foot structure. Diabetes can cause changes in foot structure of the feet, including deformities such as hammer toes, bunions, or even a charcot foot. A charcot foot is a condition in which the bones of the feet weaken and collapse, leading to deformity and instability. So these changes in structure and function can pose several challenges for patients in terms of mobility and sensation. It can be like increased risk of falls. So neuropathy can affect the balance and coordination, increasing the risk of falls, especially in older adults with diabetes. Difficulty in walking, foot deformities, and neuropathy can make it difficult for patients to walk comfortably. Pain, numbness, or tingling in the feet can also affect gait and mobility. Risk of foot ulcers and infections. So decreased sensation in the feet make it difficult for the patients to detect minor injuries or blisters, which can lead to the development of foot ulcers. Poor circulation further complicates the healing process and increases the risk of infection. Delayed wound healing, poor circulation and neuropathy can impair the body's ability to heal wounds, leading to a chronic ulcer and an increased risk of complications such as gangrene. Overall, diabetic foot complications can significantly impact a patient's quality of life and may require careful management by the healthcare professionals to prevent serious complications such as amputation. Regular foot examinations, again coming back to that, proper foot care and management of blood sugar levels is really essential in minimizing these complications. Yeah.
Okay, perfect. Moving on to the next question, are there any dietary, as you said that we need to have a perfect diet also, right? So are there any dietary or nutritional recommendations that can help people with diabetes to maintain better foot health?
Yes. So there are dietary and nutritional recommendations that can help people with diabetes maintain better foot health and reduce the risk of complications. First of all, obviously, it's control your blood sugar levels. One of the most important aspects of managing diabetes and preventing complications is to control your blood sugar levels. I cannot emphasize enough on this. Consistently high blood sugar levels can contribute to the nerve damage and poor circulation, increasing the risk of foot complications. Eating a balanced diet, monitoring carbohydrate intake, taking prescribed medications or insulin as directed by your healthcare provider can help keep your blood sugar levels within a healthy range. Followed by your balanced diet. A balanced diet which is rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can again help you manage your sugars well and promote your overall health. Limiting intake of processed foods, sugary snacks, and sugary beverages can also prevent spikes in your blood sugar levels. You have also to watch your portion sizes. Monitoring your portion sizes is important for managing blood sugar levels and preventing a weight gain. Eating smaller, more frequent meals throughout the day can help regulate blood sugar levels and prevent large spikes or drops. You have to choose foods with low glycemic index. Now, foods with low glycemic index release sugar into the bloodstream more slowly, which can help prevent rapid spikes in the blood sugar levels. Examples of low sugar level, low glycemic foods can be low starchy vegetables.
What are the potential complications of diabetic neuropathy and peripheral vascular disease on foot health, and how can these be managed or prevented?
Okay, so first let me explain the difference between peripheral vascular disease, that is PVD, and diabetic neuropathy. So PVD and diabetic neuropathy are both common complications associated with diabetes, but affect the body in different ways. So PVD refers to a condition circulation of blood to the extremities, such as the legs and feet. In PVD, vessels that carry blood to arms and organs outside of the heart and brain come. This reduces flow to these areas, leading to symptoms such as leg pain, cramp, numbness, and coldness in the legs and feet. PVD is also caused by atherosclerosis, which is the buildup of plaque in the arteries, narrowing them and restricting blood flow. Diabetes is a significant risk factor for developing PVD, as high blood sugar levels can accelerate the progression of atherosclerosis. PVD can also increase the risk of complications such as non-healing wounds, ulcers, tissue damage due to poor circulation. In severe cases, it can lead to critical lung ischemia, where there is a severe lack of blood flow, potentially resulting in tissue death and the need for amputation. So regular foot examination is a must. Individuals with diabetes should have regular foot examinations by healthcare providers to check signs of any neuropathy, vascular disease, and foot ulcers. Foot care. So proper foot care is essential for preventing complications. It includes daily inspection of the feet for blisters, sores, keeping the feet clean and moisturized, and wearing properly fitting shoes to prevent friction and pressure injuries. Next is obviously blood sugar control. Maintaining optimal blood sugar control levels can help or prevent the slow progression of neuropathy and peripheral vascular disease. This involves adhering to the healthy diet, taking medications prescribed, and monitoring blood sugar levels regularly. Now coming to footwear. So wearing appropriate footwear such as well-fitting shoes with cushioned soles and adequate support can help prevent foot injuries and ulcers. Individuals with diabetes should avoid going barefoot and inspect their shoes regularly for any signs of wear or damage. I would like to add an interesting fact over here. So mainly in diabetes, the feet tend to swell up as the day progresses. So always try out and buy new shoes later in the afternoon or in the evening, as the feet will have some room to swell up. Next, is smoking cessation. Smoking can further impair your circulation and increase the risk of complication in individuals with diabetes. Smoking can help improve circulation and reduce the risk of peripheral vascular disease and its complications. Exercise. Regular physical activity can improve circulation and overall foot health. However, individuals with diabetes should consult their healthcare provider before starting any exercise to ensure it's safe and appropriate for them. Medication and intervention, obviously, they should have regular follow-ups to see if there are any changes in the treatment to be done. Yes.
Okay, perfect. Moving ahead, can you explain the relationship between diabetes and wound healing in the context of foot ulcers and what treatment options are?
Yeah, one of our. Okay, yeah. So, in individual diabetes, wound healing, particularly in the context of food ulcers, can be significantly impaired due to various factors associated with the disease. Here's how diabetes affects wound healing. So, first is obviously, as we said before, impaired blood flow. Diabetes can lead to peripheral vascular disease again, which reduces blood flow to the extremities, including the feet. Now, poor blood flow can impair the delivery of oxygen and other nutrients to the wound site, slowing down the whole healing process. Next is neuropathy. As we discussed before, diabetic neuropathy cause reduced sensation in the feet, making it difficult for the individual to detect any kind of injuries, ulcers. Detection and treatment of foot ulcers can lead to chronic wounds and increase in the resistance. Now, it weaken the whole immune system, making individuals more susceptible to infections. Chronic hyperglycemia, that is high blood sugar levels, can also impair immune function, further complicating wound healing and increasing the risk of infection. So for treatment options, we have wound debridement. Removal of the dead and infected tissue from the wound site is essential to promote healing and prevent the spread of the infection. Offloading of the feet. Now, offloading pressure of the ulcer site is crucial to prevent further trauma and promote healing. This may involve wearing special footwear or devices or walker, wheelchairs to reduce the pressure on the affected foot. Wound dressings. Now, applying appropriate wound dressings can help create a most moist wound environment conducive to healing while protecting the wound from further injury and infection. Dressings may include like antimicrobial dressings, hydrocolloids, foams, allergenic dressings, depending on the characteristic of the ulcer. Now, next we come to topical treatments. Topical medications such as antimicrobial agents, growth factors, or cytokines may be applied to the wound, promoting healing or prevent infection. Negative pressure wound therapy. Now, this is also coming in the treatment part. That is the NPWT, which involves applying negative pressure to the wound site using a specialized dressing and vacuum system, which we call as back dressing. This technique promotes wound healing by removing the excess fluid, reducing edema, and stimulating blood flow to the wound area. There's also this thing called hyperbaric oxygen therapy. This involves breathing pure oxygen in pressurized chamber, which increases oxygen delivery to the wound. This is antibiotics, specialized antibiotics taking into consideration culture reports and which antibiotics are prescribed to treat the infection and prevent its spread. And if this all doesn't work, then we obviously come to the next final part, that is a intervention, where the healing does not, promote, which is not promoting healing. Surgical interventions such as grafting, flap reconstruction, or amputation may be the last cause, which can be the final step which we can take in the treatment of this diabetic foot.
Okay.
Yeah.
How do lifestyle factors such as smoking or sedentary behavior contribute to the development and progression of diabetic foot complications?
Yes. Smoking. So smoking actually impairs your circulation, which is smoking also known to constrict the blood vessels and reduce the blood flow to the extremities. Now, with individuals with diabetes who have already compromised circulation due to PVD, so smoking exacerbates the condition, further reducing the blood flow to the feet. Now, poor circulation impairs wound healing and increases the risk of complications such as foot ulcers and gangrene. Increased risk of infection. Now, smoking also weakens your immune system and impairs the body's ability to fight off infections. In individuals with diabetes who are already at risk of infection due to high blood sugar levels and neuropathy, smoking further elevates the risk of developing infections in foot ulcers or wounds. Smoking also delays your wound healing. It is shown that it impairs the body's ability to heal wounds by reducing the oxygen delivery to tissues and impairing the cellular function. In individuals with diabetes, impaired wound healing can lead to, again, chronic foot ulcers, which are prone to infections and complications. And obviously, of these complications, you increase the risk of amputation. So due to combination of impaired circulation, increased risk of infection, and delayed wound healing, smoking significantly increases the risk of lower extremity amputations in individuals with diabetes. Next, we come to sedentary behavior. Again, is quite similar. Impaired circulation because of we have sedentary behavior and not physically active and all, characterized by prolonged sitting and lack of physical activity, can contribute to the poor circulation of individuals with diabetes. So reduced physical activity leads to decreased muscle contraction, which is essential for promoting blood flow and maintaining vascular health. Poor circulation exacerbates existing peripheral vascular disease and increase the risk of foot complications such as ulcers and gangrene. Increase So sedentary behavior is a risk factor for obesity, which is associated with insulin resistance and poor glycemic control in individuals with diabetes. So the cycle starts that you are not able to control your sugars, which can obviously lead to diabetic foot because of the increased weight on your feet and knees. It all the cycle starts. So getting your sugars under control again is a very important part of this. Muscle weakness and balance problems. So lack of physical activity can also lead to muscle weakness, particularly in the lower extremities again, because of weak knees and feet, which can impair the balance and coordination, especially in the obese people and older people. So this increases the increases the risk of falls and traumatic injuries, which individuals with diabetes. Again, delayed wound healing, sedentary behavior with associated with impaired immune function and delayed wound healing. It is compromised immune responses to infections, leading to delayed healing of foot ulcers and increased risk of complications. Yeah.
Perfect. Okay, coming on to the last question for the session. Are there any emerging technologies or advancements in diabetic foot care, and how do they improve outcomes for people with diabetes?
Okay. So we already have CGMs which are integrated with the foot health monitoring. So CGMs, that are the continuous glucose monitoring devices, continuously monitor your glucose levels in real time and can be integrated with sensors that monitor for foot health parameters such as temperature, pressure, and moisture. So this integration allows for early detection of potential foot problems such as ulcers or infection, enabling prompt intervention and reducing the risk of complications. Next is advanced wound dressings. There have been many innovations in wound dressings, including the development of biomaterial-based dressings that promote healing by providing a moist wound environment, controlled infection, and enhanced tissue regeneration. So some advanced dressing incorporate antimicrobial agents or growth factors to accelerate wound healing in diabetic foot ulcers. Next is telemedicine with remote monitoring. So telemedicine platforms and remote monitoring devices enable individuals with diabetes to receive timely patients and monitoring of foot health from their doctors, regardless of geographical locations. So a person can be in any part of the world, and the doctor, he can provide through an app or a telemedicine or the remote monitoring, the whole cloud system. The doctor can monitor the blood sugars in real time, and then if there is any issue, the patient can get back to the doctor and then tell them, be it any part of the world. So then they can, this is a really good thing now that we have good access to internet, and also we are making use of this. This helps us in early detection of food complications, reduce the need for frequent in-person visits, and improves access to specialized care, particularly in undeserved areas such as villages, rural areas. So they can be a part, they can come under the doctors which are in metropolitan cities. So now we also have 3D printing technologies for custom orthotics and footwear. So 3D printing allows you the fabrication of custom orthotic devices and footwear tailored to the individual's foot anatomy and specific needs. Like say, everybody has a different size of ulcer or whatever the case the wound may be. So 3D printing can help you map the wound, and you can make it tailored according to your specific needs. So this can help you redistribute pressure, reduce friction, and improve the foot alignment, thereby reducing the risk of foot ulcers and other complications with people with diabetes. We have also now augmented reality and virtual reality for patient education and training. So AR and VR technologies can be used to educate individuals with diabetes about foot care practices, provide foot care footwear selection, and importance of regular foot examinations. So these immersive technologies provide interactive and engaging educational experiences, empowering patients to take an active role in managing the foot health and preventing complications. Last, obviously, as it is trending in all the fields, artificial intelligence for predictive analytics and personalized care. So AI algorithms can analyze the large data sets for clinical and patient data to identify the patterns, predict outcomes, and provide personalized recommendations for diabetic foot care. AI-powered tools can assist healthcare providers in risk stratification, early detection of foot complication, and treatment planning, ultimately improving outcomes for people with diabetes. So overall, all these emerging technologies and advancement in diabetic foot care have the potential to revolutionize the management of foot complications in individuals with diabetes by enabling early detection, personalized intervention, and improved access to specialized care. By leveraging these innovative solution, healthcare providers can enhance patient outcomes, reducing the incidence of lower extremity amputations and improve the overall quality of life. But it all comes down to like there may be many advancement in technology, but it all comes down to the grassroots problems, which are the financial issues. But so the simple fact is, like to summarize it all, we could only say that keep a like we always take the most taken care of is part of our body is the face, but we also in diabetics we need to take care of our feet because it's you could say that it's a neglected part of our feet, especially in diabetes. They need to check their feet every night for any small cuts because we if it goes unnoticed, it can lead to amputations of their foot. They can even lose the limb completely. So it's like stick test treatment or like you tell the doctor like you tailored treatments, but the grassroots level, that is a financial up and coming, but technological advancements are much and there will be many technological advancements but the thing is people are in India, we have many financially like lower financial class, which basic thing is controlling the blood sugar, and food is an important part of our life. So taking having a dietitian in hand, it all to summarize everything, having a dietitian, blood sugar level should be under control, and checking your feet all the time is the main thing.
Okay. Okay. Perfect. Thank you so much for your time, Doctor. I suppose we've got all the answers and we do not have anything in the comment section as well. Just still check once. Yeah, I guess we're done with all the questions. Thank you so much for being a part of our live session. It was great meeting you.
Okay.
And I'm really sorry for the inconvenience.
Thank you for having me. No, that's absolutely all right.
Okay, before ending the live session, I would like to inform our audience that at THIP Media, we're dedicated to delivering expert health information for your well-informed choices. We would request to avoid any unreliable health advice media. You can follow the Healthy Indian Project on YouTube, on Instagram, platforms as well. We also have a diabetes community WhatsApp. For the same, you can find the link in our bio. Right, remember, when you know better, you live better. Thank you so much, Doctor. We'll see you again.
Yeah. Thank you. Sure.